Yes, welcome back. Health Outreach Liberia. Better health, better life. Health for one, health for all. I mean, health for all. No matter who you are, what tribes you are, what color you are, as long you are in the confines of Liberia territory, health for all. So today, we've been discussing neglected tropical diseases, their causative agents, their symptoms, and their treatment. So we have already discussed two, which is the Bruley ulcer. Bruley ulcer is the illness. Mycobacterium or Syrian is the pathogen. Then the disease carrying agent is unknown. And then we discuss Chaga disease, which happen to be the American trypanosomiasis, which is the illness, the pathogen Trypanosoma cruzi, and then the disease carrying agent Triatomine bug. They are found in the western region. And third on our list, we're going to be discussing dengue fever. And dengue fever is a mosquito-borne disease that is mosquito-borne viral infection that is very common in warm or tropical climates. And the infection is caused by one of the four closely related dengue fever dengue viruses, which are called the serotypes, and they can lead to a spectrum of symptoms, including extremely mild, which is unnoticeable symptoms, those that may require medical intervention and hospitalization. And hospitalization and medical intervention only require severe dengue fever cases, and the treatment for dengue fever is unknown right now. Dengue fever treatment is unknown, and there is no treatment for dengue fever. Earlier this year, WHO listed dengue fever as a potential threat among 10 diseases for 2019. And current outbreak in many countries confirm this observation. Dengue epidemics tend to have seasonal pattern, with transmission often peaking during or after rainy season. There are several factors contributing to the increase, and they include the high mosquito population level. When we discuss about high mosquito population level, that brought us down to our own country, Liberia. This is on a worldwide perspective, and we are discussing what affects us in Liberia as citizens. So I was opportune to be on a team that carry on an assessment in the FDA community. The topic was the prevalence of malaria diseases amongst citizens of FDA community, and we came to the conclusion that FDA community is one of the breeding places of mosquitoes due to many factors, and those factors are the leading factor when it comes to mosquito-borne diseases such as dengue fever, malaria, all of the diseases caused by the plasmodium. So some factors relating to FDA being a mosquito breeding center is the sanitary landfill, which is not really in FDA community but rather telecom, but FDA community is little or less 500 meters away from the sanitary landfill. where you have the leaches. When we talk about the leaches, are the liquids that leave the waste that has been deposited within a landfill, and the improper management of the leaches can cause the breeding of mosquitoes and other insects such as cockroaches, such as flies, horse flies. They are all there, and some factors affecting FDA community when it comes to mosquito breeding has to do with the open defecation, the swarmy environment, and then the deposition, the irregularity in depositing waste, and the poor collection of waste material and poor irrigation management in FDA community. So, having said that, we visited clinics. We visited about 3 clinics, and we recorded our data. And our data was very alarming when it comes to malaria infection among the citizens of FDA community. Mind you, not just FDA community, but other communities that are highly affected by waste disposal, or other communities that have stagnated waters where mosquito go and breed. Some communities that have no regular defecation patterns, such as toilet, septic tank, or inside bathroom, to manage the influx of insects within a community. That can lead to many complications when it comes to other illnesses. So our findings there were very alarming, and then it showcased that our people are in a difficult situation when it comes to malaria infestation. And my dear listeners, although we are discussing neglected tropical diseases, but I try to bring this in because what we are discussing is the same as what I'm discussing right now when it comes to the malaria infestation. I'm talking about what I see, what I saw. What I saw, it was very alarming that our central government need to do more. For me, I would recommend that sanitary landfill should not be in the heart of the city. But I know when they established the landfill site at that time, telecom community, as we all know, it was not that populated when it comes to settlement. But now I think it is highly mandating that the government find another isolated area in order to maximize or maintain our waste disposal. So let's go further into our topics. I just wanted to enlighten the mind of people when it comes to infestation. Okay, like we said, if the symptoms attached to dengue fever, they have the same symptom when it comes to malaria, because more tropical neglected diseases have almost similarities of symptoms, so you won't know which one varies from which one. So we have list of symptoms for dengue fever, and is firstly on the list is fever, next is headache and pain behind the eyes, muscle and joint pain, nasal or vomiting, as we say, rash, or you can have fatigue, muscle fatigue, or fatigue in the entire body. So as the disease progresses, patient can also suffer from respiratory distress, which is your breathing pattern will not be too normal. You will not breathe correctly. You will have difficulty in breathing, and then bleeding from the nose and gum have a rapid drop in blood pressure, leading to shock. Sometimes you bleed from your nose, which you call nasal bleeding, which is also nasal, and then bleeding from the gum within your mouth, because and then have a rapid drop in blood pressure, because your blood pressure will drop, and then the rate of pumping blood to your entire part of the body will not be sufficient, because your blood pressure is being tampered with, and blood is being going outside, and then another thing is forcing the heart not to pump blood all over. Notwithstanding, shock, sometimes it causes muscular shock, it causes tissue shock, and as we all know, shock is something that has to do with your body having a cramp or something stiff in somewhere, and where you barely move your body parts at will. Shock in that moment of time. And then we go, like we said, dengue fever doesn't have a treatment, but dengue fever have something like prophylaxis. And when we use the word prophylaxis, it's almost like something I use to prevent something from occurring. Like for malaria, the prophylaxis for malaria is Fensida. Fensida, if you happen to take Fensida, you will not just contact malaria like that. It is not that you can get malaria. It is obvious that you can get malaria, but prophylaxis is there as the preventive measure when it comes to malaria infection. But prophylaxis, which is Fensida is not the treatment for malaria. Don't be deceived. Do not be deceived. Fensida, or as we call it, Melaxim, other company will bring it with their brand names. Fensida is not a treatment for malaria. So dengue fever has prophylaxis, but you don't have a particular treatment. So some of the prophylaxis for dengue fever has to do with paracetamol to bring down the fever as indicated, and aspirin related to non-steroid anti-inflammatory drugs, which has to do with the pain tablet, the Labde relief, as you know, is being marketed by Winners Pharmaceutical. It is produced by Elaborate Pharmaceutical in India, and it is my sole distributor in Liberia is Winners Pharmaceutical, and it is a very, very good anti-inflammatory drugs when it comes to inflammatory problems. It solves many problems such as toothache, gut pain, fever, and so forth. So we got next on the list of prophylaxis for dengue fever treatment, which is the ibuprofen. Ibuprofen is another anti-inflammatory drug that help to alleviate the severity of dengue fever. So to avoid getting dengue fever, the best way to prevent the infection is to avoid being bitten by the mosquito during the daytime. Mind you, dengue fever is a mosquito-borne viral infection that is common in warm tropical regions, and this mosquito only bites you at daytime. So make sure to avoid yourself being bitten by this mosquito during the daytime. So you should wear clothing that covers the body well, and you should keep mosquitoes out of the house by placing insect screen or doors, even windows. Apply insect repellents. When we say insect repellents, that is mosquito repellents, such as we got other insect repellents that is sell around. You can just spray your house with it and then leave the house for some minutes, and all of the insects will be gone. Dead. So sleep on an insecticide treated net so that you can avoid being bitten by these serotypes mosquito in a day. So the next on our list, which will have to be the fourth tropical neglected disease, is draconiasis. Somebody will ask, what are called draconiasis? What is draconiasis? But let me tell you, it has a simple name, which is the guinea worm disease. If you ever heard about the guinea worm disease, then we are talking about draconiasis. Health outreach Liberia. Better health, better life. Health for one, health for all. We proceed. Guinea worm disease is caused by the parasitic worm Draconiasis melanodensis or guinea worm. This worm is the largest of the tissue parasite affecting humans. The adult female, which carries about 3 million embryos, just imagine, is such a parasite enters your body, and then the female possesses about 3 million embryo. That is 3 millions of Dracunculus medanensis. That is the name of the worm, Dracunculus medanensis. About 3 million embryos. Can measure 600 to 800 millimeter in length and 2 millimeter in diameter. When a person drinks contaminated water from a pond or swallow open wells, the cyclops is dissolved by the gastric acid of the stomach, and larvae are released and migrate through the intestinal wall. Draconiasis live in the intestine. They call them guinea worm. Its disease-carrying agent is the Dracunculus medanensis, and the illness is draconiasis or guinea worm disease. So we go to the symptom of draconiasis. Draconiasis is rarely fatal, which means it just don't kill people. It highly kills people. It's rarely fatal. That doesn't mean that it is not fatal. Understand the English and listen well. Guinea worm disease or draconiasis is rarely fatal. Frequently, however, the patient remains sick for several months, mainly because 1. The emergence of the worm, sometimes several is accompanied by painful oedema, intense generalized pruritus, blistering, and an ulceration of the area from which the worm emerges. So if the worm enters your body, it will have an opening, which is called the ulcer. The ulcer is refers to as the sore that is found and the entering, and then it will make a blister that will emerge on your skin. Second one here, through the symptomatic means, the migration and emergence of the worm occur in sensitive parts of the body. Sometimes the articular spaces can lead to permanent disability. Also caused by the emergence of the worm invariably develop secondary bacterial infection, which exacerbate inflammation and pain, resulting in temporary disability and accidental rupture. So we look at the treatment of draconiasis. As stated by the WHO, draconiasis is very, very, very infectious. It affects the intestines, and it is caused by the pathogen Dracunculus medanensis, and there is no treatment or drug available to prevent or heal this parasite disease. Dracunculiasis is, however, relatively easy to eliminate and eventually eradicate. So that means they can self-limit. They have lifespan. Sometimes they die in their life cycle. So some preventive measures, because since there is no available drug, there must be a preventive measure that is associated with dracunculiasis. Effective surveillance to detect all cases within 24 hours of worm emergence and contaminants of all cases. Ensuring access to safe drinking water and converting unsafe sources to safe ones. The construction of coping around wellheads or the installation of boreholes with hand pumps. Those are the preventive measures of dracunculiasis. And then we go to the fifth one, which have to do with echinococcosis. Echinococcosis is a parasitic disease that occurs in two main forms in hemocystics in human beings. Rather, we have the cystic echinococcosis, also known as hydatidosis, and alveolar echinococcosis caused by the tapeworm Echinococcus granulus. We have Echinococcus multicularis and then Echinococcus granulus. The word is very big, echinococcosis, but it has simple meaning. Worm that affects our stomach. Tapeworm, roundworm, they are echinococcosis. So in our overview here, we have dog and foxes are all carnivores that the other worms invade their intestine and evacuate the parasite egg in their feces. If the eggs are ingested by human, they develop into a larva in several organs, meaning the liver and lungs. So many echinococcosis live in our liver and our lungs, and we are accidental hosts. We are not the disease-carrying agent of echinococcosis. The disease-carrying agents of echinococcosis having to be with dog and foxes. Those are the primary hosts. In echinococcosis, we have the primary host, we have the secondary host, and we have the accidental host. And then we happen to be the accidental host because there is no propensity that echinococcosis or Echinococcus granulus, which having to be the worms, to invade our body. There is no propensity of it entering our body anywhere, except by ingesting the primary host, which is the dog, the foxes. People who eat foxes, people who eat dog. You should be aware that they are disease-carrying agent, and then they might or might not have echinococcosis. So the symptom of echinococcosis, like I said, echinococcosis affect people two different ways. We have the cystic echinococcosis, which can produce cysts, and we have the alveolar echinococcosis, which attack the lungs, and the cyst echinococcosis attack the liver. Because when we use the word alveolar echinococcosis, it means breathing. So it is type of worm, we call it multicularis, Echinococcus multicularis. They are the one who affect the lungs, and the Echinococcus granulus are the one who affect the liver. So the Echinococcus granulus are the one who produce cysts, and the Echinococcus multicularis are the one we refer to as alveolar echinococcosis. So we'll go to the symptom. Echinococcosis are characterized by an asymptomatic incubation period that can last many years until the parasite cyst evolve and trigger clinical sign. You can have echinococcus that cyst in your system will not replicate until many years before it try to evolve and trigger the clinical sign. Depending on the location and size of the cyst, the pressure exerted on the surrounding tissue. In cystic echinococcus, the larval stages of the parasite develop as one or more cysts, many in liver and lungs, and less frequently in the bones, kidney, spleen, muscle, central nervous system, and eyes. So, in continuation, some common symptoms of echinococcus are cough, chest pain, and shortness of breath when they have replicated and then formed their cyst, and then they have brought in some clinical sign. Then you will start to experience cough, chest pain, and shortness of breath. Like I said previously, most of tropical neglected diseases have common symptoms when it comes to the symptomatic procedure and notifying the disease. So the laboratory will be very involved with the task to identify those diseases as it comes. So the treatment for both cystic echinococcus and alveolar echinococcus can be very expensive and complicated to treat, sometimes requiring extensive surgery and or prolonged drug therapy. So if you allow the worm to grow in your stomach too much and then they form that a million cells in your system, then you have to lead to surgery, prolonged drug therapy. You have to continuously be administer drug over a time or period of time, and then some chemotherapy would be needed. And when we talk about chemotherapy, we're talking about going on a screening to know what happened in your system. So number 6 on tropical neglected disease for today's topics will have to do with foodborne trematose infection. We are still discussing worms here. When we use the word foodborne trematose infection, there are a group of diseases that include the parasite Clonochis opisthecochis, Fasciola, and Paragonimus. There are 3 different: parasite Clonochis opisthecochis, Fasciola, and Paragonimus. These parasite flukes have a complex life cycle involving diverse definitive hosts and 1 or 2 intermediate hosts. Foodborne trematose cause infection in humans via the consumption of contaminated food, raw fish, crustacean, or vegetables. Infection can result in severe liver and lung diseases, and together these diseases are estimated to cause 2 million life years lost to disability and death worldwide every year. Some symptoms of foodborne trematose: the public health burden attached to foodborne trematose is predominantly due to morbidity, which is injuries. We talk about morbidity, we talk about injuries, we talk about illnesses, that is morbidity, rather than mortality. Mortality is the death, morbidity is the injury cause. disability, that is mobility. It has adverse reaction. Early and light infection often go unnoticed. Chronic infections are associated with severe mobility, with symptoms reflecting the organ in which the other worms are located in. The clonoches and the Opistocris species have other fluids that lodge in the smaller bile duct of the liver. Like I said previously, we're going to be using some big terms, and those are public health terms that need to be used. Fasciola, other worms lodge in larger bile ducts and gallbladder. They have minifying the bile ducts and the gallbladder, resulting in inflammation, fibrosis, blockage, colic pain, and jaundice. Chronic infection can result in liver cirrhosis. What I mean by fibrosis, blockage, colic pain, and jaundice? Jaundice is the yellowish color that you find in the eyes, maybe eye lobe yellowish brown. That is jaundice. And blockage have to do with stalking of nose and something. So we move forward to the treatment of foodborne trematose. Some has to do with the preventive chemotherapy involved population-based approach, where everyone in a given region or area is given medicine irrespective of their infectious status. Because foodborne trematose is a worldwide something, so if they are doing the chemotherapy, they put you into a cohort, so everybody in one place will receive medication irrespective of your infectious status. I will go to number 7. Human African trypanosomiasis. Mind you, we discussed Shaka disease, but it was only related to American trypanosomiasis. Now we have human African trypanosomiasis, which is commonly called sleeping sickness. Human African trypanosomiasis, subscript heart, or sleeping sickness is caused by trypanosoma, a trypanosome parasite that are transmitted by tsetse fly. Human African trypanosomiasis is found only in sub-Saharan Africa. 2 subspecies of Trypanosoma brucei cause disease. Then we have the TB gambiense in West and Central Africa, and TB rhodesiense in East Africa. So the Trypanosoma brucei, they come in 2 different forms. We call them the Trypanosoma brucei gambiense in West and Trypanosoma brucei rhodesiense in East Africa. Then the symptoms of this sleeping sickness: after infection, trypanosoma multiply in the blood and lymph. First stage, hemolymphatic, and following a variable incubation period from days to months. Unspecific symptoms and signs such as headache, fever, weakness, joint pain, and lymphadenopathic appears. We run through the treatment. Sorry, 1 minute. I'm gonna be back shortly.